Welcome to True Health Tuesday, and the truth will set you free. Okay, today we're going to talk about the psychosis of America. I mean, we're going to talk about symptoms versus the actual cause. And we're going to talk about this, okay, over social media. And we're going to be presenting information. Now, this is going to be censored in the next couple of years. Now, even though we're not going to be mentioning things that you know, a lot of the public is concerned with, like SB 276, how the medical doctors are now no longer going to be able to give a medical exemption, and the state will now be your medical doctor. We're not going to be talking about that tonight. We're not going to be talking about how the state is now your doctor in California, and that if you have any exemptions, religious exemptions in New York, that those are now disallowed. Okay, so, you know, it's just if you want to go to synagogue or church or public place and you don't have your papers to show proof, okay, then you can't go there. You must be inside, you know, with the other people. Okay, well, what's interesting is look at this quote here by Ben Franklin. Who would ever overthrow the liberty of a nation must begin by subduing the freedom of speech. So that, and I brought this up before, I may disagree with what you say, but I'll defend to my death your right to say it. One thing that's worse than hearing about all the violence and bad news on television is not being permitted to hear it. Now, we have to change our worldview. Now, because things are changing so rapidly. Now, you've heard about the First Amendment, okay, and this is really important that you know kind of the gist of it. But you think that you had a group of wealthy farmers that were paying taxes to a monarchy 3,000 miles away, and they were being treated unfairly, and what they thought rights weren't given. And they felt that one thing that should be important is the freedom to say in a public space, the freedom to choose your own religion. The First Amendment guarantees freedom concerning religion, expression, assembly, and the right to petition. It forbids Congress from both promoting one religion over the other, also restricting an individual's religious practices. It guarantees freedom of expression by prohibiting Congress from restricting the press or the rights of individuals to speak freely. It also guarantees the right of citizens to assemble peaceably and to petition their government. Well, this was eliminated last month, June 13th in 2019. And in fact, the law eliminating religious exemptions took place. Now, and it's all based on fear and ignorance. Now, if we look back, okay, to before the measles vaccine was in existence, we had 4 million cases of measles every year. And that equated to about 400 deaths. So it was about 1 death per every million people. Now, we know that there was vitamin A deficiency and there was other secondary things, but also that the benefits of getting measles, we've talked about that, how there's less heart disease, less cancer, and it's a workout for the immune system as long as you're a healthy person. So looking at that's important, but also when you know that there have been 51 cases of, according to the health department, of measles in California in the last 6 months. Now, that sounds bad, except for 41 of them were in adults. Okay, so this whole craziness is building the infrastructure for the adult vaccine schedule. Why? Because it's fear and ignorance. Okay, so the New York State senator heard from his constituents who hold deep and sincere religious beliefs that would absolutely be outraged that anyone would suggest they don't care about the health of their children. Exactly, they're following their belief systems. I personally believe that my body gets stronger with certain infections, and that if I live a healthy lifestyle, that my body will live a long and healthy lifestyle, just like my great-grandpa, just like my great-grandmas. I mean, all of the people in my family that have lived long and healthy by practicing normal practices. However, unvaccinated students will have 30 days to show their papers to the officials that they received their first dose of the required immunizations. In April, New York City health officials declared a public health emergency. Parents of unvaccinated children could be fined $1,000 for not complying. I say pay the fine, okay, go to jail. This is the only way that revolutions can take place. The problem is, I don't like giving up like a place to live. I don't like giving up this. I don't like giving up my serving a community. But we may have to go to jail in order to glut the jails to change the system. Now, John F. Kennedy, he knew that things were coming down. Without debate, without criticism, no administration, no country can succeed, and no republic can survive. That is why the Athenian lawmaker Solon decreed it a crime for any citizen to shrink from controversy. It's my duty. And that is why our press was protected by the First Amendment, the only business in America specifically protected by the Constitution, not primarily to amuse and entertain, not to emphasize the trivial and sentimental, not to simply give the public what it wants, but to inform, to arouse, to reflect, to state our dangers, our opportunities, to indicate our crises and our choices, to lead, mold, educate, and sometimes even anger public opinion. It is your duty as a citizen of this planet, not of America, because that's going to be dissolved if we keep going down this route. But we are a citizen of this planet, and we got to make a statement. Okay, so now let's go on to the real craziness. Treating the symptom instead of the cause. So what does that mean? Okay, so think of this. I mean, I literally had a patient last week that said, "Doc, my sciatica is so much better." And I go, okay, was the sciatic nerve the problem or a clue to the problem? Well, it feels better. And I said, I don't care. 90% of the nerves that come out the spine, there's no pain fibers. Okay, but unless you understand that there really was a problem. So the sciatic nerves have 5 roots. Was it all 5 roots? No, doc, it was only that disc. Okay, so it was only the one disc. Why was that the problem? Well, my torso was off. Oh, okay, so was it really the torso off? No. It was actually the accident I had 20 years ago that reversed the curve of my neck. Oh, so you're telling me that symptom, sciatic nerve, wasn't a problem in the first place. It was actually a clue to a dysfunction that was putting you in a stress state. Okay? Back pain, neck pain. If that's a problem, let's just drug it. Why should we look any further? High blood pressure, type 2 diabetes, inflammatory bowel disease, or anxiety. Critical thinking is completely missing in the medical system. Completely missing in healthcare. Completely missing. Okay? Somebody comes in with high blood pressure. What's the official cause? Unknown. Idiopathic. Well, it doesn't matter. I don't know what's wrong with you, but I have drugs to treat you. Okay? Low back pain. Why should we take any interest in that? Everybody's going to have it. Let's drug it. Okay? So this kind of thing, it doesn't make any sense. Anxiety, stress, depression. Gee, in my world, I think it's, what was it? Frontal lobe dysfunction? That's where anxiety, stress, depression is. So I would look for the toxicity and deficiency and altered mechanisms that supply that frontal lobe when confronted with a patient with anxiety. I would also look at the gut function, since that's where serotonin is produced. This is critical thinking, but in stupid world, okay, where we take a symptom and react. You take a symptom, you get the drug, you got to, because that's what the standards of care are. If you're not complying with this, then you're screwed. The problem is every drug used to treat a symptom causes the symptom it's designed to treat. Every drug. What's the side effect of muscle relaxants? Muscle spasms. What's the side of antidepressants? Suicide, suicidal thoughts. Okay, so let's just take, now this was this week. Okay, it's Tuesday. I only worked Monday before this. These are the patients that came in, and it's just like mind-blowing, okay? 48-year-old gal, low back pain, years of low back pain, okay? Neck pain, anxiety, and sleep issues. Now, she had 3 epidurals. This is her x-rays. Okay, do you see that the entire torso is shifted off? Just for the heck of it, try sitting like this and see where you feel it. Okay, if you're looking at the neck, there's also a Lassa curve. It's actually a reversal curve in the neck. We're looking at over 10 years to 15 years of damage in the neck. We're looking at degeneration, all of this stuff. And the doctor isn't going to look at the mechanics. He's going to shoot her lumbar with 3 epidurals. Okay, does that sound intelligent? No, there's no critical thinking, because that epidural isn't going to instantly go, wow, the biomechanics and proprioception is completely off. I'm going to correct that now that I have a shot. Okay, but now let's give some muscle relaxants. Now, yes, I know the side effect of muscle relaxants is muscle spasm. Stop saying that. Okay, but when you look at this, you think, wait a second, that's crazy. What about non-steroidal anti-inflammatories? Yes, they inhibit proteoglycan production, the building block of cartilage. I mean, last week I was at our clinic in Mexico, and this doctor brought in her patient, and the patient's sitting there, and I said, what kind of medications are you taking? Well, I'm taking Motrin. I said, well, that's in a class of non-steroidal anti-inflammatories. Is inflammation a repair process or pathology? And the doctor said, it's a repair process. And I said, okay, so you're giving a drug to stop the repair process. And the patient looked at the doctor and went, okay, so years of non-steroidal anti-inflammatories. Now this is putting the body in a chronic stress state. Okay, is that going to help the frontal lobe or alter it? Knowing that the structure is sending signals up to that cerebellum, which is altering frontal lobe function, if you've had pain for years, is depression and anxiety and stress a normal end result of that? Yes or yes? Abso-friggin-lutely. Okay, and that's her stress test showing that she's in a sympathetic dominant state. So everything, okay, people are presenting with an intelligent responses. Your body is responding correctly based on the environment. This means anxiety, stress, depression, high blood pressure, irritable bowel, inflammatory bowel. Any condition you can imagine is an intelligent response by the body based on the stimulus. If you sit your body on an iceberg and all of a sudden all the blood vessels to your extremities shut off so they turn black and fall off, that's your body protecting the core. Okay? This is how the bodies work. You live your life through the nervous system. You have one part that keeps you alive under stress. That's the sympathetic. So if you're in a stress state, you're worried about SB 276 losing your rights, man, that's going to be a sympathetic dominant, okay? If you're blissfully ignorant, you're in a parasympathetic state. No, parasympathetic is rest, digest, and repair. That's basically activated at nighttime. Okay, the sympathetic. So we need a balance of this. You got to regenerate tissue. You got to get aggressive and live. Okay, so we need that balance. When we're looking at this, the autonomic nervous system is in 2 parts. Now, it covers the entire body. If you were able to remove skin, you could still recognize every member of your family just by the nerves. Okay, and this is so important because where can you touch your body that you can't feel it? No, there's always a nerve there. And so the body is designed to communicate through this. So now let's just look at physical, chemical, and emotional stress. The body responds the same way to all 3. So when you're in a stress state, do you want blood supply going to the gut or blood supply going to arms and legs so you could run away? Well, the blood's going to arms and legs, it's got to come away from the gut. So we're talking decreased blood supply to the gut. Poor sleep patterns, fatigue, low thyroid function, because just like the autonomic, we have the sympathetic, parasympathetic. Okay, when the sympathetic is high, the parasympathetic's low. When the adrenal glands are high, the thyroid's low. That's a metabolic balance. How many people are misdiagnosed with low functioning thyroid? Okay, just about everyone. Okay, how many times have I had a patient come in here and they're taking lavoxothiorine, okay, they've been taking it for years, and I say, okay, get this, have you ever had your thyroid removed? No, my doctor just put me on it because he said it was bad. Okay, now, can a thyroid function without a heart? No. Can a thyroid function without an adrenal gland? No. How does the thyroid function with nutrient deficiencies? Oh, it doesn't work really well. So where's the critical thinking in applying this T4, synthetic 3,4, T4 that's not really recognized by every aspect of the body? It's nuts. So in a sympathetic dominant, and this is from physical, chemical, emotional stress, your body will respond correctly if you've been in that state for a while with adrenal fatigue, low functioning thyroid, poor sleep, fatigue, slow gastric motility, 1 poop a day if you're lucky, low stomach acid. This is going to be reflux. Also, joint pain diffuse because you can't break the proteins to amino acids, so you're not breaking down stuff. Weakened immune system response. This is where people come in and say, oh, I got Epstein-Barr virus. Oh, I was just diagnosed with Lyme disease. No, you weren't. Okay, think of this. If it comes from deer ticks, 100 people get bit by a deer tick, okay? And they all are infected with this Lyme disease. Are they all going to come down with it? No. 100 people walk through a swamp full of malaria. They all get bit. Are all of them going to get malaria? No, because you've got the immune system. So it's not the pathogen that is attacking you. It's the weakening the immune system response. Does that make sense? So then we look at frontal lobe adaptation, anxiety, stress, depression, impulse control. I don't have much anymore. Elevations in blood pressure. Why? Because you're running away from danger. Elevations in blood pressure. I mean, the blood sugar. So does this mean type 2 diabetes doesn't exist? That's an adaptive physiological response to physical, chemical, or emotional stress? I'll ask patients, I'll say, oh, okay, so you've been taking metformin or glucophage for type 2 diabetes. Okay, do you realize that if you lower blood glucose, that the risk of cardiovascular disease increases? That all you got to do is change your diet and it goes away. So if you change your diet and it goes away, is that really a disease or is that an adaptation to a toxic deficient environment? And so let's look at two interesting diseases. Idiopathic, which means the cause is unknown. Iatrogenic means that the therapies cause the disease. Iatrogenic means the therapies caused the disease. Idiopathic means the cause of the disease is unknown. If you have a doctor that doesn't know the cause of the disease and he says it's genetic, your second cousin Aunt Harold had, some type of condition, okay, that's ridiculous because he's completely ignorant of genetic or genetic expression. Okay, so you have to find a different doctor because obviously this guy doesn't know anatomy, physiology, neurology, autonomic function. He doesn't know genetics. He needs to go change tires. He needs to work on something that if he screws up, it's not going to cost a person's life. Okay, well, wait, tires are pretty important. Okay, he needs to flip burgers. Okay, because even if you burn a burger, wait, no, that's, never mind. He needs to do something that's safe. Okay, so now here, you can chisel this in stone. Eventually, I want to get a tattoo. I don't think this will be on it, okay? But this should be. Treating the adaptation to stress symptoms without addressing the cause adds further stresses in the patient and causes further adaptation to symptoms. Is that brilliant? Yeah, I know, I wrote it. Okay. There was a guy, one of my favorite speakers, Fred Barge, he would quote himself. and he would, and God, I loved him. He just had this beautiful voice, okay? That was my attempt at quoting me. But it just makes sense. I mean, if you're not going to treat the source of it, and you're further taxing the body by suppressing the symptoms, you're causing more problems. Here's another patient that came in yesterday, okay? Wrist pain of 5 years. Now, if you have pain of 5 years, is your blood pressure going to be cool or elevated? Elevated, okay? Now, knowing that you've been in a stress state, because higher blood pressure, what's the thyroid going to look like? A little on the low side. Why? Because you're in a stress state. Now, headache, would that cause you more stress? Absolutely. Anxiety? Absolutely. You go to grab stuff and your wrist hurts. So the brilliant doctor said, one of your bones in your wrist is too long and we need to shorten it. Okay, so now remember, this guy has cultural authority. He's got a white jacket, and she's been hurting for 5 years. She's been to a bunch of people. Of course, they shot her with some cortisone, steroids, non-steroidal anti-inflammatories, 2 high blood pressure medications for years, 1 thyroid medication for years, 1 to 3 non-steroidal anti-inflammatories for years, and an allergy medication. Now, it's true that this is a cocktail of medications that nobody knows what it's going to do. But I asked her, I said, your wrist has worked good for over half a century. Do you think that one of the bones shrunk or one of them grew in the last couple of years? Okay, common sense says neither. So I take an x-ray, I find that she has a reverse curve at the base of the neck, and it turns out that carpal tunnel syndrome, elbow, golfer's elbow, tennis elbow, rotator cuff problems, all are double crush injuries coming from the neck. Now, the brilliant doctor that says the wrist bones were too long and let's cut it off, he didn't take an x-ray of the neck. Then you can see on the x-ray, the full spine one there, that there's a significant lateral deviation and curve. And I asked her, when I looked at this, do you have any heart palpitations? Yeah. Okay. So let's look at, and again, these are real people, real cases that came in yesterday. Okay? I deal with this stuff every freaking day. I'm going, your doctors are insane. And then when you get a patient taking 5 or 6 different medications, like I had this afternoon, I couldn't put her x-rays up because we didn't take them yet. Okay, and I said, okay, look, you and me, we're on a desert island. You don't have access to the antidepressant, the thyroid, the muscle relaxant, the sleep medication, the gabapentin, I think it was omeprazole. Okay, so she was taking like 7 medications. I said, okay, you and me, we're on a desert island. All you get is fresh fruit, fresh water, fresh vegetables, no access to pharmaceuticals. Would your health improve and decline? She said, Improve. Everybody says that. We all know innately. The worst I've ever seen is 32 prescriptions. This is one person every friggin' day, except it was more than 32 because some of them had to be taken a couple of times a day. So I said, look, if we're alone left on a desert island, would your health improve or decline? Well, it would improve. Okay, people innately know that this stuff is dangerous, but they don't have an out, because the people in cultural authority are into that symptom drug therapy. Insane logic. What's the cause of low functioning thyroid? Hashimoto's thyroiditis. What's the cause of Hashimoto's thyroiditis? Unknown. What's the cause of fibromyalgia? Unknown, but we have tons of drugs to treat it with. What about complex regional pain syndrome? It's believed to be caused by damage to or malfunction of peripheral or central nervous systems. But by God, we're not going to take x-rays of that and find it because we can't change the shape of it. So we're just going to drug it. What about essential hypertension, high blood pressure? I've had discussions with MDs, people who are very close to my family. And I've said, have you ever thought of looking for an autonomic dysfunction or a sympathetic dominant state in people with high blood pressure? And this one guy, MD for 35 years, we know the cause of it. It's idiopathic. Wow. And no, this was in a state that weed's not legal. Okay, so we have an inflammatory bowel disease. What's the cause of this? Idiopathic, unknown. Okay, now let's just say we take any other animal species on the planet, anyone, you pick it, caribou, beavers, giraffes. Let's say we have a rash of inflammatory bowel disease. Would you look at their vaccination schedule, their diet, or their medication use first? Perhaps. Except those creatures don't do stupid stuff like that. Okay, they actually eat normal beaver food or bear food or giraffe food. Okay, so you would look at their diet, right? Okay, good. So this is 60% of our population has a chronic illness or disease, according to the Center for Disease Control. 40% of Americans are deeply screwed because they have 2 or more of these conditions. Okay, heart disease. What's the common cause? Hardening of the arteries. What's that from? Lifestyle. Cancer. Genetic mutations you're born with, you can acquire through your life, but they work together. These don't cause cancer. It has to be lifestyle factors. So this means environmental stimulus. That means carcinogens, medications, vaccines, all the things that say it can cause cancer. Chronic obstructive pulmonary disease. Okay, this is from reaction to environmental stimulus. It's supposed to be bronchitis, asthma, and emphysema. Okay, all of those have solutions. Strokes, hardening by hardening the arteries. Wait, let's go back to heart disease because obviously it's from lifestyle factors again. Then we look at Alzheimer's disease. Wait a second. Lifestyle factors, environmental causes, knowing that we're going to have a 1-in-1 ratio means 100% of us. Okay, I'm planning on not going there with the majority, okay, but we're going to have some kind of brain damage. So this means that we have a toxic deficient environment. Type 2 diabetes, lifestyle factors, okay? Again, this is an environmental stimulus. It's a long-term poisoning of our population. Chronic kidney disease, it's the same thing as diabetes and high blood pressure. What's that? Lifestyle factors causing the arteries to not function correctly. So what's the cause of 60% of our population having a chronic illness or injury that they will never recover from? It's an environmental cause and it's an adaptation. It's an adaptation. But by gosh, drugging the friggin' symptoms make you sicker. Instead of, and I've had discussions with doctors before, well, Bergman, they'll follow your advice, but, they have type 2 diabetes and high blood pressure, so I just figure it's a better idea to give them the medications to lower it while they make their changes. Okay, I said, Doc, why don't you tell them the truth? Okay, if you keep on this pathway, your body will break down faster than it builds up. You will die early and you're going to die bad. You change your lifestyle. Within 2 weeks, your blood sugar will be normal. If you start checking their blood pressure correctly and we get you out of the stress state, it'll take about 2 weeks to have your blood pressure normalized. You're going to be sleeping better. You're going to be pooping 2 to 3 times a day. You start walking a little bit better. I'm going to show you techniques on how to deal with the physical, chemical, emotional stress. If you take these drugs, you're going to die early and bad. That's what I tell people. It's called the truth. It works. Let's look at the diseases caused by the therapies. With the multitude of drugs prescribed to a single patient, adverse drug reactions are bound to occur. Duh. One of the basic principles of treatment stated by Hippocrates. Oh, by the way, the Hippocratic Oath is no longer utilized in medical schools. Okay, no longer. It was revised back in the late 60s, but now anyone can choose their own oath. So in the old days, okay, first do no harm, stories of medical remedies causing more harm than good have been recorded from time immemorial. However, it would be impossible to provide the benefit of modern medicine if reasonable steps in diagnosis treatment were withheld because of possible risks. Absolutely. But let's look at blood pressure. Well, for every 1 blood pressure drug you take, your risk of stroke increases about 1/3. That means if you're taking 3 blood pressure medications, your risk of stroke is around 240% greater than if you weren't on the drugs at all. So the drug designed to correct the stroke causes the stroke. Let's look at cholesterol. Cholesterol drugs are to help with hardening of the arteries. Wait a second, that chronic illness or diseases, according to the CDC, wasn't atherosclerosis one of the leading causes of stroke, kidney disease, and heart disease? It was, wasn't it? Oh shoot, cholesterol-lowering drugs do that. They harden the arteries and cause heart failure. Is this psycho world? Again, what is cholesterol? What's the function of it? It's 50% of your overall weight and brain. It's the raw material for all the hormones you make. Without cholesterol, you die. And if there's elevations in cholesterol, it's from chronic stress or inflammation. What's our diet like? Is that going to cause inflammation? Of course. Let's look at non-steroidal anti-inflammatories, okay? Linked to dementia. Or is inflammation a repair process? Okay, the theory that inflammation is a factor in Alzheimer's. However, the more non-steroidal anti-inflammatories that you took, the greater rate of brain damage. But don't buy yet, shoppers, okay, because what's the #1 drug given for joint pain? Non-steroidal anti-inflammatories. Why? I don't know. It's crazy. Why not, God, put moist heat on there? What happens if you put moist heat on your hand? What color does it turn? Say red. Good. Yeah, because your brain senses the difference in temperature. It increases the blood flow. You're causing more blood flow to the joint, which is going to increase synovial fluid production. That starts to help the metabolic processes so you can rebuild healthy joints. Oh, where's the light? Wait. Okay, somebody sent me this, and I think this is so cool. Okay, it's applause. Okay, but it also has crickets in there, and I'm dying to say a joke that nobody gets, so I'll use it. Okay, but look at this. Cardiovascular problems, hearing loss, gastrointestinal bleeding, congenital heart failure, 60% increase if you take an over-the-counter remedy. Miscarriage, atrial fib. But when you look at this, you start to think, well, why would you even prescribe it if it destroys the building block of cartilage? Where's the ethics, the morals, the science? No, it's the standard of care. The standard of care sucks when the leading cause of death in America is the American medical system. That's psychotic. When 54% of our children have a chronic illness or disease that they will never recover from. 60% of adults have a chronic illness or disease that's based on lifestyle factors that you're medicated for. This is crazy world. Let's say you read the British Journal of Medicine, or British Medical Journal, and you find out that if you take metformin or glucophage to reduce blood sugar, it works. However, insulin levels remain high. So if you reduce blood sugar by 9%, you have a 19% increase in death. Yes, I know, 2 people recovered from death, but Lazarus had help. Stop bringing that up. Gosh, Christians. 14% reduction in glucose had a 43% increase in death. Bad. Okay, now, when we look at the health of America, we have the lowest infectious disease rates in the world, okay? We have the highest maternal mortality rate of any industrialized nation. We have the sickest kids in the world. 54% have a chronic illness or disease. Now, for every one woman that dies, 7 almost die because our emergency medicine is really good. So what's the maternal mortality? What's killing the mothers of our children? What's damaging our children? Is it environmental factors like 60% of the other? How come we're not looking into it? Why? Because that would screw up the standards of care. And if your job depends on you not knowing something, you're not going to look into it. So does this mean that health is really a healthy adaptive response? That means you need higher blood pressure when you're under stress. That means that disease is an unhealthy adaptive response. So now we got to look at diagnostics. Is your blood pressure because there's a chronic subluxation pattern or a chronic stressor, or because you're not sleeping, or you have some physical, chemical, or emotional stressor? Could it be that your diet is toxic, that your blood isn't efficient at doing its job? Okay, could that mean that you need supplements and juicing or blending? Or should you take a drug that increases your risk of stroke? Nervous system controls and coordinates all functions of the body. So if you're not checking that to find out if you're in a stress state, it doesn't work. Here's a patient, 63-year-old, shoulder pain, 2 years, left breast cancer. Why is this important? Lymph for the gut drains to the upper left quadrant. Lymph for the chest and for the head drain to the upper right. So this is why we're looking at over 80% of breast lumps, tumors, and cysts are on the upper left side. This is also why antibiotics are a contributing factor to breast cancers. So when I get a patient in who's gone through this and they've had the surgery, chemo, radiation, okay, they're poisoning this, and I said, are you aware that cancer is a disease of metabolism that has to do with what you put in your body? And she goes, no, I wasn't aware of that. And I said, did the doctors that did the surgery, radiation, and chemo, and they put you on a drug to prevent future breast cancers, okay, that causes uterine and ovarian cancer, okay, did they suggest any diet changes? No. So then we look, okay, at her x-ray. She was in an extremely stressed state. We're looking at abnormal bowel gas. We're looking at, really long-term subluxations, putting her in a physical, chemical, and emotional stress load. Okay, what do you think the health of an immune system is if you have chronic stress? Good or poor? Poor. So how about anybody with a chronic illness or disease, we do a new protocol. It's going to call, SMART. Okay, we look at their body respecting it, that its adaptive response, its symptoms are an adaptation to environmental stimulus. Bam, look at the light bulb, okay? God, that makes sense. And then how about we assess their structure? How about we do bending films? We look for degeneration. When you look at grade 2 arthritis, you're looking at 15 to 20 years. You're looking at grade 3, you're looking at 15 to 30 years, okay? MRIs are not accurate. This is why when you look at MRIs, and look at this body up there, okay? Now you can see it shifts off to one side, it shifts off to the other. The head's forward and off to the side. That is a massive abnormal force loading. But what happens in crazy world? Doc, my back hurts. Well, let's get an MRI of that. Of course, I'm not going to look at the foot, the bunion formation, the altered mechanics, the pelvic instability. You hurt here. I'm going to take an MRI. Oh, there. Okay, so wow. So when you lay down, that's a completely abnormal force loading. Why? Because the clinical radiology out of London say if you're in this body posture, okay, laying down, it gives totally erroneous information. And the MRI is confused by inflammation, but the MRI wants to give you a pretty picture. So it misinterprets it. So inflammation can distort it, body position can distort it. So why do so many back systems fail that we have a billing code called failed back surgery syndrome? I'm not making this up, sir. You think I'm bullshitting you. No, there really is a code there. When you're a chiropractor, you'll get this too. Okay, they're working in the wrong spot. They're not looking at the right thing. And then when you ask them about regeneration of tissue, they're never going to see it because they give a non-steroidal anti-inflammatory that destroys the building block of the cartilage in the first place. So let's look at intelligent responses. First, if someone presents with a symptom, listen to them, but also be aware that 90% of the nerves come off their spine. There's no pain fibers. They don't know. So all you can do as a doctor is get a rough idea. But when someone's presenting with pain, look for a mechanical distortion. But if my body is like this and my butt hurts, do you think you should only look at the nerves that supply that gluteal region? Yeah. No, you got to look at the whole thing. You got to look at the full total overall structure. This is why when presented with anxiety, stress, depression, bowel disorders, blood pressure issues, I'm going to say, look, take off your shoes so I can see the feet. Because if you have an unstable pelvis, that means part of that autonomic nervous system, the rest, digest, and repair that's located in the pelvis could be compromised because the nerves that supply the feet are altered. That's where we're seeing that foot distortion. Then that clues me into something else. Look for the mechanical cause. And look for what? The solution. The solution is never the right drug, okay? Unless it's some weird exotic infection that there's only one drug that'll help you. The solution could be that if you've had your thyroid removed, you need the Armour thyroid. Okay, the solution could be that one drug if you've had so much damage to your body that they had to do an organ transplant. Okay, you need that anti-rejection drug. Those are important. Those are miracles. Those can save people. I'm talking about the definition of stupid. Given a toxic drug to somebody who's presenting a symptom, then the drug alters their physiology, causing further damage. That's stupid. Okay? Make sure you have an objective analysis that identifies the cause. Absolutely. You can't ask people, how do you feel, and get an accurate response. They don't know. How do you feel? Well, I feel good today. Okay, if you die of a heart attack tomorrow, should I have assessed you? Absolutely. 90% of the nerves that exit the spine have no pain fibers. And look at the secondary effects of chronic pain. It's high blood pressure, decreased blood supply to the gut, poor sleep patterns, anxiety, stress, depression. Those are all secondary effects. Those aren't primary. Here's 7 questions. You can find it on our website to find out if you have a good corrective chiropractor. All your chiropractor has to do is say yes to 5 of these. Okay, we got a whole video on it. But let's look at how the body works. Anytime you move, that information goes up the spine to the cerebellum. That cool little area in the back of the brain, that's actually called the tree of life. It's called the arbor vitae. I mean, if you get a chance, okay, to look at a human dissection, to see how bodies work, I mean, just telling you about it, I'm getting goosebumps, because it is a miracle. It's brilliant. Now, everything synapses in that cerebellum. That cerebellum controls the frontal lobe. So does that mean that people who have a sedentary lifestyle, the frontal lobe is going to have a dysfunction, and that's depression, anxiety, okay, bipolar disorder, schizophrenia, it's everything. So does that mean that exercise, movement, is that why exercise and movement shows consistently better than medications? Yeah, because you're actually sending information to that cerebellum, controlling the frontal lobe. Cerebellar stimulation influences frontal cortex. Okay, a delta wave cerebellar stimulation improves schizophrenia-like cognitive problems. So think of this, cerebellum, that little, so does that mean that every time we move, we get influence in that cerebellum and that stimulates the frontal lobe? Think of this. What if you've had a trauma and you're moving incorrectly? Is that going to give alternate or abhorrent information to that frontal lobe? Yes or yes? Yeah, so when confronted with depression, anxiety, or stress, should you look at the movement activities of that person during the day? Are they digging ditches or are they working on computers? Digging ditches is better. Unless, has anyone in here ever dug ditches for a plumber? I doubt it. Okay, I mean real ditches.
Absolutely.
Okay, what's a brown trout?
My father is a...
What's a brown trout?
I don't know.
It's a turd coming down the pipe. Okay? I'm telling digging sewers. Okay, I'm talking, you can see a pipe that's broken, you got to break it up, and you're in this hole, and you're digging like crazy, okay? And the guys say, watch out for the brown trout. And you go in, hey, what's all this air coming out of the pipe? And everybody's screaming to pull you out of the hole? Okay, that's digging holes. Okay, I don't know why I drifted. That was not a fun job, by the way. But I was 14 and making good money. Okay, so now, let's look at this. Cerebellar function. We're talking schizophrenia, Tourette's, autism spectrum, Parkinson's, addiction, OCD, bipolar disorder, depression. All of this stuff can be changed by getting appropriate stimulation into that cerebellum. Then we got sensory motor disturbances in the neck, postural stability and hand movement. That means if your neck has been off, like those cases I showed you, reverse curve, loss of curve, degeneration. Afferent information from the cervical receptors can be altered via a number of mechanisms. Trauma, functional impairment, receptor changes. All this means that if you've had a trauma that hasn't been corrected, you're altering brain function. Spinal kinetho, the role of manipulation in addressing sensory motor integration. If you think of this, if you have an alteration in function, it sends altered information up to the cerebellum. This changes the frontal lobe. This is how the body works. What's amazing is that the doctors who have cultural authority now are not looking at the brain as really, really important. So that brain controls the nerve supply to the gut. Does this mean every gastrointestinal problem? You have to look at the brain. What about polycystic ovary syndrome? Should you look at the brain as a controlling factor in that? Absolutely. What about the scoliosis? Is that brain firing off those paravertebrals? So all the adjustments have to alter the brain. Further understanding the regulatory mechanisms linking sympathetic and parasympathetic nerves and immune system is critical for understanding relationships between chronic disease development and immune system associated changes in autonomic function. What that means, 60% of our adult population have a chronic illness or disease that they will not recover from unless we look at the cause. 54% of our kid population will not recover from unless we look at the cause. If we continue to suck at the tit of the pharmaceutical industry, our population's going to get sicker. Okay? Regardless of the ideology, it's an autonomic dysfunction. When we look at this, okay, a subluxation interrupts the body's ability to repair, to heal. And this is why 86% of the schools, the chiropractic colleges in America, are not teaching this. They're being taken over by the medical system. They're not teaching. They're teaching diagnostic protocols. They're teaching to co-manage. They're not teaching people to look for the cause. Suck it up and follow the protocols. Don't look for anything else. So how do you assess for stress? How? Like, I'm talking to all the patients, all the doctors, every human being. First, you got to look at the whole structure. You got to do a digital x-ray of the whole thing. And I don't care if it doesn't hurt. 90% of the nerves that come off the spine, they don't have it. But if your head's forward or off to the side, that's going to alter function. We use heart rate variability, thermo scan, surface electromyography, live blood cell analysis. You get a chance to see how those cells are formed. Balance, range of motion, is that important? Yeah, let's say you can turn your head one side and can't turn it to the other. Do you think that's a dysfunction that's going to negatively affect the cerebellum, that's negatively going to affect the brain function? Yeah. How about around the cardiovascular and respiratory center? Palpatory findings. You don't have conscious control of the muscles that run down either side of the spine. If you see one side tight and the other side not, that asymmetrical firing indicates there's a problem. Okay, pelvic stability. You got to stabilize it. Now here comes the real questions, the real pertinent questions, because the quality of your life depends on the quality of questions you ask. How many bowel movements a day do you have? If they say, oh man, every day I get one. Okay, that could be constipation or you could be fasting. Okay, because you should have 2 to 3 bowel movements. If you're taking in nutrients, it should be going through you. What you're going to typically hear is people under stress. Well, one if I'm lucky. Or you see somebody with massive bunion formation, poor sleep patterns and everything else. Nope, I poop 3 times a day. I take 5 glasses of metamucil. I get a colonic every time. I do an enema 4 times a day. Yes, I flow great. I'm serious. I could show you a bunch of patients that, no, I've had patients that say, look, my son doesn't have asthma. He takes the albuterol and he's fine. I don't have high blood pressure. I take my metropol or lisinopril or, it's crazy. So ask about bowel movements. Ask about sleep patterns. Okay, do you get up at night to pee? Oh, only 3 or 4 times. Okay, that's what you'll hear. What does that mean? That means when you're in a parasympathetic state, regenerating the tissue, that your body is stimulated and you have to go up to pee. That means your ability to repair tissue is limited. Bunion formation, that means altered nerve supply to the foot, that means the pelvic instability. Medications, ask how long and what it was prescribed for. You're going to see antidepressants are typically prescribed for sleep. What does the chemically induced sleep do? It interrupts your parasympathetic activity so you can't regenerate. Look at the history of trauma. Yes, you can have a 65 and 70-year-old patient that had a skateboarding injury in the 70s. I know, I was there. Okay, diet, antibiotics, hormones. I mean, it's crazy. So what is your philosophy? Is it allopathetic, where a term refers to science-based modern medicine such as the use of medications or surgery to treat or suppress symptoms of the ill effects of disease? Treat and suppress symptoms. I don't see cause anywhere in there. Vitalism is that the body is responding correctly based on the stimulus. We just got to find the stimulus. Okay, now these are x-rays that I got from a seminar, I think back in 2005. And it's mind-blowing, but I just want you to go through. Okay, that's a normal side view on the neck. That one on the right is showing pathology at C5, C6. Forward head carriage loss. For every 1 inch the head's forward, the pressure on the disc doubles. So 1961. What would he present with? Neck pain? Would everyone agree? Loss of curve. They took an x-ray for a reason. Okay, so 2 years later, does he still have the neck pain? Yeah, but he was given, what do you think? Non-steroidal anti-inflammatories. 1961, going to be aspirin, something like that. Okay, something cool. But we're seeing a progression of the degeneration. Okay, so then we get 1965, we're seeing further progression and further forward head carriage. By now, he's had it for 4 years of neck pain. It's not bad enough to do a surgery, because a surgery, you could die. So this way, it could be treated with drugs, possibly an injection. What's his blood pressure like? 68. Further progression, now the osteophytes are forming big time to stabilize an unstable segment. I don't know if he can still be helped at this moment. I would like to get a stress x-ray and get a good assessment. 72, now it's progressing up to the next level. Is he on blood pressure and cholesterol medications now? How's his sleep? What are his bowel movements like? Okay, we're watching a guy slowly freaking die before our eyes because of the ignorance of just dealing with symptoms. Now it's progressing up to 3 levels. Okay, what do you think his hands are like? Do you think numbness and tingling? Do you think he can't pick up his grandkid now? 75. Now we're seeing huge osteophytes, massive formation. It's been 14 years. And so the medications that he's on now, after 14 years of pain, what do you think his brain is like? What do you think his anxiety or stress levels like? What do you think his memory is like? What do you think his brain fog's like? Well, it turns out that according to the British Medical Journal, this entire biomedical model of illness is wrong. That to look for the single underlying cause, treat the symptom, doesn't work. You got to look at the overall structure. Removal of the disease will return to health. Evidence exists that all 3 of these assumptions are wrong, and they are. We live our life through the nervous system. That's it, bottom line. Your body's going to adapt correctly based on every stimulus. So what do we know now? We know the nervous system controls and coordinates every function of the body. That's fact. Fact. There is no arguing that. The brain responds to the environment through the nervous system. Fact. It could respond to some good alcohol and drugs like they have next door. That would be pathology. So you're all right, sir. There is a caveat there. Yeah, let's not do that, okay? Brains are really important, okay? I don't want to lose any brain cells, okay? DNA or genetic expression is based on your interpretation of the environment. That's true. If you misinterpret that a peanut protein is not dangerous, it can throw you into a shock and kill you. This is why now they have peanut-free days at the ballpark, and you can't open a bag of peanuts on the airplane because our species is so hypersensitive to those things. Physical, chemical, and emotional stress can be misinterpreted as a disease. Duh. Look at all the diseases that are idiopathic. Okay, altering the input to the brain can alter both structure and function. That's neuroplasticity, and dealing with the stressors can reduce or eliminate the disease. This means look for the cause. This means add critical thinking. Now, since our diet is full of inflammation, let's give antioxidants to make that inflammation work. These are not anti-inflammatories. They make actual inflammation, which is a healing process of the body, function correctly. Let food be your medicine and medicine be your food. How about healthy amounts of vitamin C? Does that sound good? Yeah. Oranges, apples. I mean, I can show you a recipe for an avocado pudding that was out of this freaking world. Okay, you put some fresh bananas in there, avocado, coconut milk, cacao, little bit of cinnamon, OMG, and a little bit of grade B organic maple syrup. Okay, natural sources of vitamin E. I mean, this looks good. It's just a lift. Look at normal sources. Vitamin A. If you're concerned about measles, eat this. Okay, vitamin A deficiency is one of the negatives, and if you have vitamin A sufficiency, you're going to be okay. So when we talk about the 5 keys of health, none of these are dealing with symptoms. If you maintain the integrity of your body and you respect it, nerve supply, exercise, if man makes it, you don't eat it. Eat just what your grandparents ate, sufficient rest and prayer and meditation. Why? Because we're more energetic beings than we are physical. Look at Extreme Health Academy. Please go there, sign up, because whatever condition you got, I guarantee you somebody in one of those forums has it. And they found a solution, and they found out what doesn't work, and they found out what does. That's one of the most educated populations around. This, our Puerto Vallarta seminar, I don't know, I think there's still a couple of rooms left, but this we're going to study for half a day, play a half a day, and get together and just hang out. It's the teaching is going to be actually pretty darn cool. I got a great thing on brain function that I know it sounds like nerdy, but it's really friggin' cool. Okay, and then the cruise in April. Okay, and we also redid our site, and this is something that's absolutely exceptional. I've got a writer who's an engineer who is absolutely friggin' brilliant, and my son says he writes the way I think. So he is definitely a brother from another mother, thank God. But here's two girls, twin girls. They live in Arizona. Okay, they come here for care. It took them 9 years to prove that they got autism from the DPT shot. Now, according to the law, there's no medical exemption for them if they move to California. They will not be able to get the DPT shot, but they will be forced to get every other shot. Why? Because that's what the CDC guidelines say. It's time we take back our health. Okay, any questions? Let's make a difference. Thank you very much.